All right, so the outer ear as a whole is made up of skin, cartilage, and bone. The outer ear has a few different parts that I'm going to be talking about today for you, Calvin. Starting with the pinna or auricle, which is basically just the part of the ear that we can see, and it's just made up of skin and cartilage. It can also be broken down into smaller pieces, such as the helix, which is just this outside rim right here, followed by the scaphoid fossa, which is located just right here. Followed by that, we have the antihelix, which is this rim, the inside. And then after, we have the antitragus and the tragus. So the tragus is just this part right here, and then the antitragus is just on the inside of it. After that, we have the concha, which is just this kind of like indent here, this little bowl. And then we have the triangular fossa, which is just located up here. So the pinna and all these parts mentioned are what's in charge of funneling and directing sound waves from all around you. They send it in through your external auditory canal, which I have right here, and then through to your TM or tympanic membrane to the middle ear, which then gets pushed into the inner ear and then to the brain to be processed. And that's just the very general path that speech takes into our body. I think it's also important to mention that the pinna helps with front or back directionality, just meaning that sound will travel around the pinna and into the ear. So after the pinna, we move on to the previously mentioned external auditory canal, which, like I said, just right here. It's normally about 2.5 to 3 centimeters long. Mine is more like 2 to 3 inches right now, just because wanted to make it bigger, so easier to see, easier to explain. So at the end of the short tube, you'll find yourself at the tympanic membrane, also known as the eardrum. The narrowest part of the canal is known as the isthmus, and it's about 1 centimeter. The ear canal also isn't quite as straight as I show it here. It has 2 bends, and one I kind of put in here. It's hard to see, but it's like inside of there. So yeah, it normally has 2 bends, and it normally works up and forward. It normally works up and forward and then back through the 2 bends. So the lateral 1/3 is cartilage, and then the medial 2/3 is bone. But it does, however, vary slightly from front to back. And also another quick side note is that normally men have larger canals than female. So now we have made our way down to the tympanic membrane. And while I didn't add one to the end of the ear canal here, I do have this. And sticky note, not the best representation, but I will say it is somewhat accurate in terms to the size of the TM, very thin as we know, so not bad there. So normally it's angled at about 40 to 55 degrees, and you see here how the manubrium of the malleus is pointed. So this is the right ear. Normally, if it's on the left, what'll happen is rather than coming this way, and then the umbo points here, it'll come down from this way, and the umbo will point to this side. So the TM protects the middle ear from debris and bacteria, and it's made up of 3 different layers. So first, you have your layer of skin, which is essentially just like a continuation of your canal skin. It's followed by the fibrous layer, which is what gives the tympanic membrane its tension and its stiffness. And then lastly is the mucus layer, which lines the middle ear. So similar to the pinna, the tympanic membrane has landmarks on it. I just mentioned some of them, but I'll name them all. So right up here, we have our pars flaccida, and then this long piece right here is going to be your manubrium of the malleus, and then this is going to be your umbo, and then right down here is your cone of light, and then normally a little bit above your cone of light in this general area here is going to be your pars tensa, and then I just have this circle around here to represent your annular ligament, or also known as the annulus. And then also you might ask why I drew all the 4 sections here, and that's simply just to represent the 4 sections that the tympanic membrane is split up into. So those are the anterior superior, the posterior superior, the posterior interior, and the anterior interior. So in general, that covers the outer ear. I hope this was informative for you, Kelvin, and thank you very much for watching.